Hello, West Michigan. It's a winter day, but we're inside, so we're all set. And we have a very nice gentleman with us today, and his name is?
Dr. Jim Donley.
And you are?
I'm a dentist, and I am specializing in dental sleep medicine.
And your office is on the Causeway, but what's the number?
We're at 166 North Causeway in North Muskegon.
Mm-hmm. That's right, you're on the North Muskegon end. I always forget that. I'm used to it, though. But we haven't had a visit like this in several years now. And you taught me a lot about the dental industry way back then. And I'm sure that a little bit of everything has caught up with us now, seeing that there's research and development going on in every aspect of our lives. Am I right?
There's considerable changes going on. Dentistry is probably one of the fastest changing of the health professions.
And I believe it. I remember from when I was a kid, and it's not that hard to remember that far back, and I think of how my children were taken care of, and coming on into my grandchildren and my great-grands, so I haven't become a teacher of it, but it's interesting to see what has occurred.
There's just tremendous changes have been going on, and kids today can grow up having few or no cavities and keep their teeth a lifetime.
Well, if it's possible to keep the teeth, you need, and part of it is a good nutritional balanced diet.
That's part of it for sure, but a good share of it is preventing the infection that causes decay, and the infection that causes periodontal or gum disease.
Okay, and what is it that causes the periodontal disease?
The basic cause of periodontal disease is inadequate home care starting when you're young and allowing bad bacteria to grow and cause pockets around the teeth, which causes the gums to recede and causes breath problems, and actually shortens your life. There was a recent study that was completed in Sweden. It was a 12-year study of about at least 4,000 people, and they tracked the tooth loss, and they found out that at the end of that time, those that had 10 or few teeth remaining had 7 times the risk of having cardiovascular disease as those that had 25 or more teeth.
You're kidding. That much?
That much.
In other words, heart trouble is the worst of all.
The infection that comes from gum disease gets into the bloodstream. The bacteria cause blood clots, and they also cause the plaque or contribute to the plaque that builds up in the arteries. And so there's a doubling of the risk for stroke and heart attack, besides increasing the risk for diabetes. And it's also a factor in several cancers, and they've linked it to Alzheimer's.
In other words, whatever goes in here can cause you all kinds of problems.
It's what goes in and then what stays there.
Yeah. Well, what goes in usually stays anyhow. But how can the average citizen figure out what to do? Never mind, I know the answer. Come and see you.
Yeah. It all starts with good flossing and brushing when you're young. preventing it. But if you have periodontal disease, which affects probably 75 to 80% of adults, then you need treatment to bring it under control and treatment to reverse the damage that's been done.
How young should a child be when you teach them to brush the teeth, and then how to use the floss?
Children don't have the physical dexterity until they're at least 8 or 9 to do a reasonable job of cleaning their own teeth.
Really?
So we ask parents to be responsible to do that for them once a day in the evening before they go to bed. It's good for kids to do it just to get the habit. They're not going to be effective with what they're doing, but if you develop that habit young, then it can be a lifelong habit, which goes a long ways.
I never thought of that way. I was just told that kids had to be sure to brush their teeth at night and in the morning.
They need one good cleaning a day, and parents should do that. And teeth should be cleaned as soon as they erupt, as soon as they come into the mouth, when the first tooth comes in. And actually, parents can even start doing something before that. They can take just a washcloth and rub it over the gums, just to get the child used to you doing something in their mouth.
I think I was born ahead of my time, or maybe I should say way behind. Yeah, I never thought of it in that way. And even any training that we were given as new mothers, that was never brought into the question.
I can believe that, and they probably didn't tell you that when you're pregnant, you have 7 times the risk of having a premature low birth weight baby if you have gum infection. 27% of preemies are due to gum infection.
No, you're telling me something I have never heard, and I haven't.
Oh, it's a message that we keep trying to get out in our office.
Is it that we don't listen to you, or what?
I think most offices probably haven't been educated to the point of educating their patients.
Because I have heard more from you over these years than I've heard from any other dentist, including the ones that have taken care of me.
I was fortunate. A few years after I started practice, I listened to a dental evangelist, is what I called him.
Mm-hmm.
He looked at the research that had been done back in the 40s with proper flossing and brushing. And he was going around the country lecturing to dentists in dental schools. And I went down to Lansing one time and listened to him one weekend. And it just changed my view on how dentistry should be practiced.
I thought I was brought up knowing I had to go to the dentist so many times a year, and that was it.
Yeah.
Don't argue with Mama, and if you go to Papa, he's going to tell you to listen to Mama.
And do you know why you were told to go to the dentist twice a year?
No.
Because Amos and Andy had a little jingle when they were selling Colgate toothpaste to brush your teeth twice a day and see a dentist twice a year.
No kidding.
And that was where it came about. Because there's many individuals that need to see the dentist more often than twice a year when they have periodontal disease.
This program is sponsored in part by